Welcome back to another episode of From Dust to Verdict. I'm your host, James Nevin, a partner at the law firm of Brayton, Purcell, LLP. This podcast is dedicated to the epidemic of accelerated silicosis in artificial stone countertop fabrication workers. In each episode, we explore important topics and issues about this occupational health epidemic caused by uniquely toxic artificial stone slabs, as well as the associated litigation. Today in episode 14, the April 16, 2026 Standards Board hearing, OSHA Hears from the workers, we recap the final Standards Board hearing before the May 21st vote. The Standards Board finally invited actual countertop fabrication workers to speak instead of only listening to the slab manufacturer lobbyists. First, we heard from Crispin from Orange County. He began working in countertop fabrication at age 19 and was diagnosed with artificial stone silicosis in 2024. He states that manufacturers and suppliers never warned workers about the heightened dangers of artificial stone and believes the product should be removed from the market to prevent further harm.
My name is Crispin, and I was diagnosed with silicosis in 2024. I started working in the countertop fabrication industry when I was 19 years old. I got the job through a recommendation from a friend who already worked in a granite shop. At first, we worked mainly with granite and marble, but a few years later, artificial stone started to arrive, and over time it became the main material we worked with. We had to figure it out on our own. There was always a lot of dust. Even though we cut with water all the time, the dust was everywhere. We always used masks, but the dust still got in anyway. There was no special mask for this type of material. You could feel how the dust entered our lungs. The dust would stick to our skin. It made you itch, and we didn't know it was going to cause an illness, because the same dust from natural stone never made us sick. We got used to the smell and the dust because we didn't know the danger. Artificial stone became more popular because it had more colors. It was smoother, more resistant to stains. That made it more attractive to customers. But the manufacturers and slab suppliers never warned us that this material could make us sick or kill us. If we had known that working with this product could lead us to an incurable disease, we would not have kept doing this work. I would have chosen another job. The manufacturers and suppliers are responsible for what happened to me and to many others. When they sold us artificial stone, the manufacturers and slab distributors did not explain that it was different or more dangerous than natural stone. We used the same tools, the same procedures, and the same masks we had always used for granite. The companies that manufactured or sold these slabs never went to the shop to explain the risks, the safety measures, or special protections. They sold the product and left us to figure it out on our own. They put this product on the market without warning the people who had to cut it, polish it, and breathe its dust every day. I want them to stop selling this material because there are still many workers who are not yet sick and don't know what is coming. This product continues harming people who have no idea of the danger they are facing because they keep lying and saying it's natural.
Next, we heard from Jesus from Solano County. He worked in the artificial stone industry in the San Francisco Bay Area and was diagnosed with silicosis in 2024. He emphasizes that slab manufacturers knew the risk, but failed to warn workers, and no one should lose their health or future over a kitchen countertop.
My name is Jesus. I worked in the stone countertop industry for 16 years, starting in 2006, and I was diagnosed with silicosis in 2024. When I began this work, I had no experience in stone fabrication. I learned everything on the job. I spent most of my time in the shop where we fabricated kitchen countertops and bathroom pieces. We worked from templates that others prepared, and our job was to cut the stone to size and prepare it for installation. All cutting was done in the shop. Later in my career, I also worked as an installer in homes. From the beginning, most of the material we worked with was artificial stone. Most of the stone was artificial, and only a small portion was natural stone. We worked with many different brands and types of stone. But artificial materials were by far the most common. I worked full-time and many times more than that, including Saturdays, holidays, Christmas, and New Year's. I worked throughout the Bay Area. The manufacturers and suppliers of artificial stone never warned me that these materials could destroy my lungs. No one explained that artificial stone dust could cause a disability or the need for a lung transplant. At that time, the job was presented as a skilled and honest trade, a job that allowed me to support myself and my family. It wasn't until many years later, after I had already been exposed for a long time, that I began to understand the danger only after I became sick. By then, the damage was already done. When I was diagnosed with silicosis, I told my employer. He was saddened and read about the disease for the first time after I explained it to him, but there was nothing that could be done at that point. The manufacturers and suppliers of artificial stone had already sold the product. The work had already been done. My lungs were permanently damaged. What I want the public to understand is that these fake artificial stone products are still being sold. The companies that manufacture and sell artificial stone know what they are selling. They know what happens when these materials are cut and fabricated, and even so, workers continue getting sick and dying. I am here because this can be prevented. No one should lose their health or their future over a kitchen countertop.
Oscar from Los Angeles County was diagnosed with artificial stone silicosis in 2022. He explains that despite using water and masks, workers were never informed of the true risk, and manufacturers continue to falsely equate artificial stone with natural stone.
My name is Oscar, and I worked in the granite and artificial stone industry for 16 years, and I was diagnosed with silicosis in 2022. For many years, I worked very long shifts in this trade. I worked in different shops, and the work depended on the level of detail the client requested. Cutting the stone, shaping it, and giving it the final finish. Even though we always used water, there was always dust. There was dust in the air while we cut and worked the stone. Looking at it now, it's clear that as long as this material continues to be cut and shaped, workers will continue breathing that dust. I worked very hard to support my family. I paid rent and supported my children and my parents. When there was a lot of work, I worked extra hours, many times staying 3 extra hours after an 8-hour shift, sometimes even working Sundays. I did it because my family depended on me. But when I got sick, I could no longer work or help them. The hardest part is that none of us knew what silicosis was. The manufacturers and suppliers never told us these materials could cause silicosis. We used masks, water, and ventilation, but no one explained what this artificial dust did to our lungs. I only learned what silicosis was when I was already sick. By then, it was already too late. It is very sad because you work to earn a living and support your family without knowing just how dangerous these artificial materials are. Manufacturers still lie today saying it's the same as natural stone. The work looked beautiful when it was finished, and I actually liked this job. I never imagined it would make me sick.
Raul from Orange County worked in countertop fabrication for 8 years, was diagnosed with artificial stone silicosis in 2024, and has since undergone a lung transplant. He supports banning artificial stone, stating that workers were never properly informed about artificial stone hazards and should not have to learn the risks only after becoming sick.
Hello, my name is Raul. I worked in the countertop fabrication industry for 8 years. I was diagnosed with silicosis in 2024, and in February I received a lung transplant. I got my first job in 2018 in countertops because my family knew someone who already worked in that industry. At first, I took pride in my work. What I liked most was the finished final product, and knowing I helped create something that looked good and the customers wanted. But the day-to-day reality was hard. There was always dirt, we always used water, but the work never felt safe. What makes all of this so frustrating is that the manufacturers and suppliers of the slabs never warned me. When I started working in the shop, no one told me anything about silica because they didn't know themselves. I didn't receive clear information about the risks from the shops, nor did I receive it from the producers or the companies that supplied the material. I only became aware of this danger when cases started surfacing. When people started getting sick, it was no longer possible to ignore it. I did try to protect myself, but I didn't even know what I was protecting myself from. I always wore a mask, but not specifically for silica, because I didn't know about it. About 2 years ago, I bought a very expensive electric mask with an air purifier. It was designed to block out dust, which is why I spent my money on it. But the truth is, workers like me shouldn't have to guess. We shouldn't have to find out about the danger only after people have already started getting sick. That's why I support banning artificial stone countertops. It would be a positive stop, something good to ensure that more people don't end up getting sick from the same cause. These companies should not be allowed to sell and distribute a product that generates dangerous dust without clear warnings, clear instructions, and real training on risks. I used to pick up materials from distributors and suppliers, and they never once mentioned the risks associated with silica. No one told me anything. Distributors and manufacturers must take responsibility for what is happening, instead of letting us workers pay the price with our health.
Next, Jose Francisco Andrade Peña from Alameda County rolled his oxygen tank up to the podium to present to the board. He described working in countertop fabrication and being diagnosed with advanced artificial stone silicosis despite always wet cutting and wearing masks. He emphasized that the slab manufacturers failed to warn workers that safer alternatives like recycled glass slabs exist, and yet his preventable disease has destroyed his health and family.
My name is Jose. I worked in the countertop fabrication industry for 33 years in the San Francisco Bay Area. In 2024, I was diagnosed with advanced artificial stone silicosis. During my career, I was repeatedly exposed to dust created while cutting and fabricating artificial stone slabs that contain crystalline silica. The shops where I worked always used water cutting systems, but that exposure still happened. It is impossible to fully prevent it. When I worked with artificial stone, I always wore a mask. Even so, the dust from artificial stone is much finer than dust from natural stone. The slab manufacturers told us it was the same than natural stone, and never explained how dangerous it really was. The artificial stone slab manufacturers never warned us. They never provided safety training, safety data sheets, or any materials explaining how dangerous artificial stone truly is. They lied to me and they lied to my employers. They continue to lie today. If we had been properly warned and educated by manufacturers, my coworkers, my employers, and I would have taken stronger precautions. The slab manufacturers and suppliers are responsible for this disease and the death it has caused. They knew they were selling a toxic product and failed to be honest about the risks. Transparency from the manufacturers could have saved lives. It is painful and frustrating to know that the government still allows this toxic product to be sold. Artificial stone should have been removed from the market long ago. This disease was preventable. Fabrication workers and shop owners have families to support. We fabricate what is available in the market. If we refuse, another shop will take the work. I am shocked to know that safer alternative products already exist, such as recycled glass slabs, yet the deadly products remain on the market. In 2023, I finally heard from manufacturers about cancer risks associated with artificial stone. But even then, they did not specifically warn about silicosis. Now that I have been diagnosed with a fatal disease, I understand what this exposure can do. I try to warn my coworkers. I tell them to protect themselves or leave the job if they can. At the same time, I understand how difficult that is. Fabrication is a skilled trade, and the income supports families. Walking away is not easy when your family depends on that paycheck. Before I got artificial stone silicosis, my life was very different. I was the person my family depended on. I worked hard, provided for them, and took pride in being strong. I could lift 60 pounds easily, work a full day, and still have energy for my family. Today, that life feels very far away. Now I can no longer work. I cannot do normal activities like taking my kids to the park, attending family gatherings, or spending time with friends. Even small outings are difficult. Simple activities cause coughing and shortness of breath. I get tired very easily and have to plan my entire life around my breathing. fatigue is constant. This illness has changed how I see myself. I often feel powerless and like a burden. I went from being a strong provider to someone who struggles every day. That loss is devastating and affects me emotionally as much as it does physically. What hurts most is seeing the impact on my family. My wife and children are heartbroken watching what I am going through. They are living with this illness with me, and their lives have changed too. That weight stays with me every day. My health continues to worsen. I have progressive silicosis and new lung damage keeps forming. I take multiple medications to reduce lung inflammation, prevent infections, and help me breathe. I rely on inhalers and oxygen. These treatments help me manage symptoms, but they do not eliminate the daily exhaustion. My doctors have told me that I will need a lung transplant. That idea terrifies me. My future depends on how my body responds to treatment, and I don't know how long my lungs will last. Living with that uncertainty is frightening. I live with sadness, frustration, fear, and powerlessness. I worry about my family and about the workers who are still being exposed without fully understanding what lies ahead. I am sharing my story because I do not want anyone else to lose their health, their livelihood, or their identity the way that I have. I ask that crystalline, silica, artificial stone slabs be prohibited before thousands more workers suffer the same fate.
Thank you, everybody.
Fabrication worker Mike Simonelli stated that his fabrication shop switched to recycled glass, zero silica slabs, and achieved air sampling results below detectable limits. He testified that these safe alternatives are viable and already working in practice, demonstrating that, like in Australia, a ban on crystalline silica slabs will not result in any job losses and save many thousands of lives.
Local fabricator here in California, and I'm calling to say that there's, the other choices. We switched to a zero silica product about 2.5 years ago when we first learned about it. And we recently had OSHA's board of people there to do air sampling, and we have results that are below zero, below detectable levels. And so I'm basically just saying that there are other products available that are not harmful as the silica-based products are, and that there is alternatives. I think like one of the speakers spoke earlier. That's all I have to say, sir.
I spoke on behalf of our now 423 California artificial stone fabrication worker clients with silicosis. I reminded the board that the presentation from Dr. Hoy from Australia that we submitted to them, and that the artificial stone death clock keeps ticking in a majority of the California fabrication shops, while they keep listening to the artificial stone manufacturer lobbyists telling them that criminalization and licensing will somehow solve the problem caused by their uniquely toxic product. Good morning. I'm James Nevin from the law firm of Brayton, Purcell. We represent, as of today, 423 California fabrication workers with artificial stone silicosis. This week, I submitted to the board the recent presentation from Dr. Ryan Hoy regarding his experience in Australia leading to its ban on crystalline silica artificial stone. Australia considered and tried increased regulation and enforcement, and it did not work. I urge you to watch the presentation from Dr. Hoy. I urge you to invite him to speak, and you can question him yourself. The CDPH dashboard reflects, as of today, 542 confirmed cases of fatal artificial stone silicosis, 57 lung transplants, and 29 deaths in workers from 715 different California fabrication shops. And we know their vetting is behind. As for example, it doesn't include the death of one of our clients just last week. The death clock keeps ticking while you study and debate the issue, certifying, licensing, and criminalizing the bottom of the supply chain while continuing to allow the top of the supply chain to sell a uniquely toxic, lethal product is not worker protection. It's an abdication of your responsibility as standard board members. Today, you heard the stories of several California workers who themselves are representing hundreds of workers just like them across the country. These are not a few criminal dry cutting shops from just a few counties that just need to be put in jail. So many of the victims are from certified, trained, wet shops working with masks from all over the country. Yet they're all dying from fatal silicosis despite following the OSHA rules. The only criminals are the foreign slab manufacturers who knew many years ago that their uniquely toxic crystalline silica product would kill human being fabrication workers. Listen to the workers. Listen to the doctors. Listen to your own Standards Board medical and scientific staff. Please adopt WOEMA's petition. At this point, every additional California worker who gets disease is the responsibility of a failed regulatory system. Thank you. Dr. Robert Blink yet again reminded the board that engineered stone is uniquely toxic and cannot be made safe through engineering controls or PPE in real-world conditions. He noted the role of the nanoscale particles, availability of safer substitutes like recycled glass, and urged immediate approval of the WOEMA petition.
Good morning, and thank you to the board, and thank you to our courageous workers who have spoken today, both remotely and in person. And I'm sorry to hear of your situation, and we're hoping to prevent others from falling into the same fate. I think you've heard all of our arguments before, but I will reiterate. We all, I think, agree that crystalline silica artificial stone is uniquely toxic and dangerous. The main point, I think, in terms of what is the right thing to do is engineering controls and personal protective equipment adequate for controlling this along with enforcement? And clearly it is not. The high degree of protection that is needed is simply not attainable in real world conditions, which requires the artistry of craftsmanship of forming these beautiful products. It simply doesn't go together. And in the most risky situations of workshops where this is actually being done, workers simply will not be using these elevated techniques, even if they were effective. I know that our industrial hygiene colleagues like to believe that controls can be done, measurements can be made, but I'd like to point out that a significant portion of the dust created in these processes is nanometric, and the measurements that are required for that, for surface area rather than mass, simply aren't available to your everyday industrial hygiene measures. Requires very expensive equipment and is debatable as to how it should be used. So also there is zero protection available to installers when this is being put into homes, and the occupants of the homes are also exposed. Simply, humans really can't do this safely, only robots. We, in addition, know that there's excellent substitutes. Cosentino has now begun selling a amorphous stone product, which is basically equivalent in California. It's available now. So why are we continuing to allow this inherently toxic material to endanger and damn our workers to unhealthy lives and early deaths? We know that there are some uncertainties still involved and that could be studied and debated. But while we wait, roughly every week, in a very conservative estimate, every week a new worker becomes doomed to have silicosis, and about every 5 weeks, a new worker gets condemned to an early death because of silicosis and its results. So we really can't afford to wait while we attain perfect certainty. We know for sure this is bad. It must be prevented. And on behalf of WOEMA, who I represent as an occupational medicine physician, we strongly recommend that the board approve the WOEMA petition and pass it on to the California OSHA staff. Thank you very much.
Rosalind de Leon Minch, representing the California Nurses Association, stated the artificial stone is uniquely hazardous and that Cal OSHA safety controls are ineffective. She urged a ban on crystalline silica artificial stone as the most protective measure to prevent an irreversible and entirely preventable disease.
Good morning. Thank you so much. My name is Rosalind DeLeon Minch, and I am an industrial hygienist with California Nurses Association. CNA represents over 100,000 registered nurses in California. And our members see the devastating impacts on patients when employers fail to provide safe and healthy workplaces. The science is clear that manufactured stone is unsafe, it's hazardous, and that cutting releases so much, lethal dust that existing controls and standards are not enough. Silicosis is irreversible. There is no treatment once you are exposed. This is a disease that no one should have to contend with because we know what causes it, and it is preventable. Nurses are trained to examine patients, not just the illnesses as they present at the hospital or the clinic, but the conditions that are causing patients to become sick in the first place. So it's clear that the most protective path forward, the path that would ensure workers are protected from deadly exposures, would be a ban on cutting engineered stone. Thank you.
Nurse practitioner Gladys Happer described accelerated silicosis as a lethal disease affecting young Latino men, citing state data on cases, deaths, and transplants. She emphasized misdiagnosis, strain on public hospitals, and urged the board to prioritize workers' lives by supporting the ban.
Good morning, members of the board. My name is Gladys Happer. I'm an LA County resident of the San Fernando Valley. I'm also a nurse practitioner, and I'm here to support the testimony of those workers whom we have heard earlier today. We've been hearing of the human impact on California workers as a result of accelerated silicosis. This is a lethal variant. It essentially ignores the traditional latency period. These aren't just patients, they're young men like those that we've just heard from. 98% of all cases are Latino men in the prime of their lives. As of today, the California Department of Public Health Silicosis Dashboard reports a staggering 543 confirmed cases statewide, with over 279 of those cases concentrated right here where I am in Los Angeles County. I want to take a quick moment to speak directly to those workers whom we've heard earlier today. En solidaridad con los trabajadores afectados y sus familias.
In solidarity with these who have been affected, you are not alone. As a nurse, I know your pain, and we are all fighting for your health.
From a clinical perspective, the numbers are devastating. The median age at diagnosis, again, from the California Department of Public Health dashboard today, is just 46 years old. The median age of death is 51 years old. By the time these workers reach a clinic, many are already in end-stage respiratory failure. Additionally, I'm sorry to say that we're seeing a high misdiagnosis rate initially, as these young men are often misdiagnosed with pneumonia or tuberculosis because they're, quote, too young for chronic lung disease. Statewide, again, from today's California Department of Public Health dashboard, at least 58 workers have undergone lung transplants just to survive, while 51 more cases have been referred for a lung transplant evaluation. Even with current mandates, the LA County DPH has noted that cases continue to rise. Our safety net hospitals in LA County, like all of you, UCLA, are treating a steady stream of these patients who are often uninsured, underinsured, adding a massive burden to our local public health infrastructure, while federal funding for screening programs is being cut. As a healthcare provider, and I am sure all of you also see this, the human cost captured in a spreadsheet, isn't reflected by the testimony of these brave workers. I see young fathers who can no longer kick around the soccer ball, who got on football because they're tethered to oxygen tanks, using inhalers, fatigued. Following the lead of countries like Australia, I urge this board to do what you do best, that is protect our workers, prioritize human life. I urge you to consider the WOEMA petition. We can't continue to let a preventable disease decimate our workforce. Thank you so much.
Dr. Kimberly Brayton from Brayton Purcell LLP explained that scientific consensus shows artificial stone causes a distinct and aggressive form of silicosis due to its unique characteristics. She explained that half measures have failed globally, and eliminating the hazard is the only effective protection.
Hi, members of the board. Thank you for the opportunity to speak again today. My name is Dr. Kimberly Brayton with Brayton Purcell LLP. OSHA's stated mission is to protect and improve the health and safety of working men and women in California. That mission is never more important than when vulnerable workers are exposed to a devastating hazard. And that mission necessarily depends on recognizing risk when the scientific signal is clear and taking effective action, even in the face of industry opposition. Your duty lies with the workers. In prior meetings on this topic, I have observed industry and ISFA representatives invoking false uncertainty to suggest that the science concerning the relationship between artificial stone and accelerated silicosis is unsettled. In reality, as reflected in WOEMA's petition, there is broad scientific and medical consensus. The scientific literature and the epidemiology consistently demonstrate that artificial stone presents a qualitatively different exposure than natural stone. In addition to its extremely high silica content, fabrication of artificial stone generates particles with increased surface area and reactivity. The presence of binding resins and volatile organic compounds further modifies particle behavior and biological response. Together, these exposure characteristics amplify pulmonary toxicity and drive the aggressive form of silicosis seen in artificial stone workers. The resulting disease pattern is equally distinctive, characterized by brief exposure durations, short disease latency, rapid radiographic progression, and high rates of progressive massive fibrosis. These features are not typical of traditional chronic occupational silicosis. They are characteristic of artificial stone silicosis. The industry has suggested that the current rise in silicosis simply reflects increased manufacturing. That hypothesis is contradicted by historical experience. In the 80s and 90s, the United States experienced a significant expansion in granite countertop fabrication. However, there was no corresponding outbreak of accelerated silicosis. What is different now is the material. The rise in accelerated silicosis closely tracks the rise in popularity of artificial stone. When uncertainty is overstated, as it has been here, it allows the embrace of half measures that may be politically palatable, but which are ineffective. Proposals focusing on licensing schemes, compliance monitoring, or even criminal prosecution of employers are not sufficient. These approaches were implemented in Australia for years before its nationwide ban, and they failed. When the hazard is extraordinarily potent, eliminating the hazard is the only measure that truly protects workers. This is the top principle of occupational health, and this is the lesson this epidemic continues to teach at an unbearable cost. The evidence is clear, the hazard is distinctive, and the consequences of delay are already being measured in permanent disability and premature death. I implore OSHA Standards Board to do its part to end this epidemic. Thank you.
Dr. Sonia Meyer, an occupational medicine doctor from Los Gatos, emphasized the hierarchy of controls, noting that PPE is the least effective while elimination is the most protective. She highlighted the unseen harms to workers' families and urged adoption of the WOEMA petition.
Hi, Chairman Aliotto. Hello, members of the Standard Board. My name is Dr. Sonia Myers. I am an occupational medicine physician down in Los Gatos and a member of the Western Occupational and Environmental Medicine Association. Thank you for arranging this. Thank you for bringing the stories of the workers here. As a physician, it's hard to see injured workers suffering from injury or illness that you can't fix. We know that the hierarchy of controls, PPE is at the very bottom and the least effective. The most effective is elimination. I think the stories, we could tell you all the science, but I think the stories of the people really make a difference. What we may not have heard from today are the families of these injured workers. I'm a child of immigrants. I have several aunts and uncles who don't speak English, even though they've come here in the 1970s. Their children have had to interpret for them in the exam room. And I know that these days we do have interpreters for our patients, but I can only imagine that being a young child and having to hear a diagnosis for your family, for your loved one, for your parent, is devastating. And I just really urge you to consider the WOEMA petition, and please keep that in mind. Thank you.
Alice Berliner from the LA Department of Public Health reported dramatic increases in silicosis cases in Los Angeles County and noted many additional cases remain unidentified. She warned that despite existing standards, risks remain high and urged stronger regulatory action given the available safe alternatives.
Chairman Aliotto and members of the board, thank you for the opportunity to make comments today. My name is Alice Berliner, and I am the director of the Los Angeles County Department of Public Health's Office of Worker Health and Safety. For nearly 3 years, our staff has been visiting stone fabrication shops in LA County and hearing firsthand from workers about their experiences. Since silicosis has become a reportable disease, the number of new cases received by our department has increased dramatically over the past year. Hundreds of workers in California have silicosis, 279 in LA County alone, although we actually just received another case a couple days ago, so that number is likely higher. And the true number of sick workers is likely unknown. These numbers translate to people who can no longer work or will soon be unable to work, and families who may soon lose a loved one. The safeguards outlined in the silica permanent standard are an important step to reduce risk when working with this toxic product through the use of wet cutting and appropriate respiratory protection. However, with each new case, it is increasingly apparent that significant risks remain with high silica content engineered stone. Without further safeguards and enforcement, thousands more workers will likely get sick and eventually die from this incurable disease. Engineered stone products were introduced in California in the early 2000s, and we can track the silicosis case progressions about a decade after when this product gained popularity in LA County, which is about how long it takes for symptoms to begin. While work practices have largely not changed in this industry over decades, the product has. There are safer alternatives that are affordable, versatile, and aesthetically pleasing, and other jurisdictions, notably Australia, have banned high silica content engineered stone products. When a person can no longer earn an income and provide financially for themselves and their family, the results can be devastating. We're not just seeing the harms of silicosis relegated to the parent or caretaker. This epidemic is inflicting trauma upon multiple generations. We strongly urge you to consider proposals before you that strengthen regulatory standards to prevent silicosis. Thank you for your time.
Sherry Belafsky from WOEMA described the silicosis epidemic as long recognized and regulatory efforts long overdue for correction after failures of PPE and engineering controls. She urged moving to elimination and substitution as the responsible course based on the hierarchy of controls.
Thank you again, members of the Standards Board. I was with you virtually at the last meeting. I'll keep my comments very briefly. My name is Sherry Belafsky. I'm an occupational medicine physician as well as president-elect of WOEMA. I guess my major point is that we've been watching a silicosis epidemic unfold for over the course of like 15 years, and we are already very late in adequately addressing this hazard, and it's time to course correct. You've heard other speakers address the hierarchy of controls, but I think all of you could relate to having or being at a place of getting a diagnosis from your physician. And sometimes we start out thinking that we're on the right track. Oh, this is the right course of intervention, this medication or this treatment. And when it's failing, we need to just pause and reflect on that and honestly assess what the situation is. And that's what I think it's our obligation to do right now. When the hierarchy of controls has failed, and yes, we started with PPE at the bottom, as one of our speakers mentioned, not due to a lack of education or intelligence of our workers, but just a failure of the PPE inadequacy, and all the way up to engineering, right? We've done what we can. It's just time to go to substitution. It's just time to course correct. I wanted to share that, and thank you so much for your time.
Kate Papadopoulos from the NorCal Occupational Nurses Association stated that despite wet cutting and respirators, dangerous dust exposure still continues and workers keep dying. She emphasized that artificial stone causes a faster, more aggressive disease and urged swift implementation of a ban.
Thank you for having this meeting. Good morning. And thank you to all the workers for their testimony. That is very brave and it's very powerful. My name is Kate Papadopoulos. I'm a nurse practitioner, and I also represent, I'm on the board of directors of the Northern California Occupational Health Nurses Association. And we are in strong support of the petition to ban engineered stone. We've heard a lot of the reasons, but as nurses, we both see and understand the science that has been piling up and studied in California and Australia. And we understand the patient perspective. We see sick and then sometimes dying workers. Just a few things to review. So remember to look at the California Department of Public Health dashboard that is tracking, because now in California, because we've been at the forefront, it's a reportable disease. So we're tracking it, and we're tracking the illness and the deaths, and it keeps on increasing. This is not a trackable disease in all states yet, so we're at the forefront. And so I hope we can continue being at the forefront in important measures like the ban. After trying protective measures, like making sure there's wet cutting, like people wearing PAPRs, studies have found that that's not even helping get the risk down to an acceptable measure. People are still dying. There's still dust. As the workers say, you can wear the mask, you can have all the wet cutting, but there's still dust. It's still getting in, as he told us before. I've never been in one of the shops, but I've seen pictures of the LA County shops where they did a lot of these studies. And yes, some of them were dry cutting before the emergency standard was implemented, but some of them were wet cutting, and the dust is still getting around. And just a point, we had one speaker say silica is silica. Silica is not silica, and that's why we're all here today. That's why the studies have been mounting. That's why there increased illness, because since this product, both the disease caused by silica it's coming on sooner, and to put it in simple terms, like it's taking fewer years to develop the disease, and it's more aggressive. People are dying faster, need to be on lung transplants. So it's imperative that we do something. Like we had an industry expert say, there are alternatives. And I'm hearing that they can be economically feasible and they're good for the consumer. Australia is using them. They're starting to be available here. So the evidence is mounting, and the faster we implement this ban, it's very important. Thank you.
Despite the extensive, unequivocal testimony from workers, doctors, and nurses, the foreign slab manufacturers and Cambria lobbyists continue to deny the truth. Representing ISFA, Martin Bermudez blamed the fabrication shop employers, arguing the silicosis results from poor implementation and enforcement, not the uniquely toxic artificial stone itself. He opposed the ban, advocating instead for strict application of the bottom of the hierarchy of controls with engineering controls and PPE, ignoring that the top of the hierarchy is elimination.
Chairman Alioto, ladies and gentlemen of the board, my name's Martin Bermudez. I'm a licensed professional engineer, certified hazardous materials manager, certified professional environmental auditor, Six Sigma black belt, etc., and an environmental health professional with over 25 years of workplace safety and regulatory experience. I appear today on behalf of the International Surface Fabricators Association, and I very much appreciate the testimony that was read today. And, as the son of a laborer, I honor the hard work of fellow laborers throughout our great state. We're very sorry that this happened. These exposures should not have happened. I'm a big believer that you can train through situations like this from previous experience dealing with hazardous materials, chemicals, gases, etc. I'm not here to minimize the tragedies that have occurred. Silicosis is real. The exposures that caused it are real. Silicosis is the product of uncontrolled exposure, inadequate ventilation, no fit tested respirators, APRs, PAPRs, powered air respirators, which were mentioned in the testimony, no wet cutting. These are failures of implementation, not necessarily failures of the technology. The hierarchy of controls, engineering controls, ventilation, respirator programs, again, training, medical surveillance. This has reduced occupational disease in mining, construction, and chemical manufacturing for over 75 years. It does work. we should be demanding it here as well and not necessarily abandoning it. I disagree with the good doctor as far as the workers who elaborate the manufactured stone, granite, quartz, what have you industry. They're neither ignorant nor untrainable, as he would like you to believe. A blanket ban would not eliminate silica exposure. It would displace it to concrete, demolition, tunneling, other verticals where fewer people are watching. It's one of the reasons why there's so many lawyers in the room at the moment. It would destroy thousands of family-owned businesses that are already investing in modern wet cutting, tables, dust collection, rear-time air monitoring, toxic gas monitors, etc. The issue itself is not the stone. Let me remind everyone here that regular tile, granite, everything contains silica. Whether it's 1% or 100%, silica is silica. So the inherent danger of silica is in that whole vertical of products. Lastly, just want to urge this board to enforce a hierarchy of controls, mandate engineering solutions, and not reject any ban that substitutes politics and pseudoscience for science. I thank you for your time.
Micah Aberson, Vice President, Cambria, opposed the ban as unrealistic and harmful to foreign slab manufacturers and Minnesota-based Cambria. He supported a fabrication-funded certification program to teach OSHA safety methods, ignoring that hundreds of peer-reviewed published literature and the CDPH fatal disease dashboard demonstrates that certification does not work. Moreover, at the exact same time that Cambria is asking the U.S. to enforce strict tariffs on all foreign manufactured artificial stone slabs, Cambria is asserting that it would somehow be impossible to enforce a ban on crystalline silica artificial stone slabs.
Good morning, and thank you for the time and your careful attention to this very important matter. My name is Micah Aberson. I serve as Executive Vice President of Government Affairs and Business Affairs at Cambria. From our 25 years of experience in the U.S. stone slab production, distribution, and fabrication, on behalf of our 1,800 workers, including almost 200 fab shop workers, we do not agree that a ban is a realistic solution to the serious workplace safety problem. There are important geographical, business, and practical factors for the board to consider. To start, as you know, California borders Mexico and has 12 ports, and the ports of Los Angeles and Long Beach handle 40% of the entire nation's import-export traffic. Additionally, neighboring states to California create a flow of stone slabs shipped by truckers. It's simply not realistic for California to cut off the flow of quartz slabs into the state. We know that importers lie to Federal Customs and Border Patrol about the type of stone slab being imported to dodge paying duties on quartz slabs. One recent example of customs fraud seen in our industry is a recent $12 million settlement by a Texas stone distributor based on claims by the DOJ related to evading anti-dumping duties on Chinese quartz products. The bottom line is that a ban will not resolve the underlying compliance issues causing the silicosis outbreak in California. Rather than a ban, we support consideration of an industry-funded certification program in partnership with OSHA that would restrict non-compliant fabrication shops from accessing all types of stone that cause silicosis when cut unsafely. I thank you for your time and consideration.
Rebecca Schultz, General Counsel of Cambria, once again blamed the fabrication workers and their employers for this epidemic rather than the uniquely toxic artificial stone slab product.
My name is Rebecca Schultz, and I serve as Cambria's legal counsel. I'm here again today to reemphasize Cambria's ongoing commitment to workplace safety and a feasible solution to the unsafe work practices that are putting vulnerable workers in California at risk. I first want to acknowledge the workers who bravely appeared today and shared their experience. Please know that we all feel deep sympathy for each of you and your families. Our concern also extends to every worker who is engaged in fabricating stone if they work for an employer who doesn't care about their safety. The very sad reality that we're all faced with here today is that occupational diseases like silicosis are preventable, and all workers deserve to be protected from dangerous working conditions. For that to happen in California, What we need to do is hold rogue employers accountable and ensure worker safety from all forms of stone that cause silicosis when cut unsafely. The only real way for that to happen is strict work safety guidance with strong enforcement and compliance measures, not a product ban. If California issues a ban on natural quartz surfacing similar to Australia, what mechanism will be in place to ensure compliance for shops that we know are already ignoring the existing OSHA regulations? Moreover, the proposed ban would only prohibit a subset of the many high silica products that are cut in these shops and that are causing overexposure to RCS and silicosis when cut unsafely. What will prevent non-compliant shops owners from simply forcing their workers to cut other types of high silica content stone in unsafe work conditions? Employers who are putting profits over people by exposing their employees to RCS must be stopped. And while a product ban might at best feel good or make workers feel safe, it won't actually prevent silicosis amongst our most vulnerable community members. There is simply no way to avoid requiring workplace safety in stone fab shops. Whether workers are exposed to stone dust, electrical hazards, or slab handling risks from just moving 1,000-pound slabs, this is work that has to be done safely in safe shops. Rather than a product ban broadly opposed by unions and compliant fabricators who support the livelihoods of thousands of hardworking Californians, we should focus on comprehensive enforcement measures that will actually lead to OSHA compliance and safety for all workers. Our industry is prepared to step up and step in to help OSHA enforce workplace safety and certify safe fabrication shops to ensure workers are protected from this preventable disease. Thank you.
Marshall Engstrom, the industrial hygienist at Cambria, ignoring that there were 0 countertop fabrication worker silicosis cases reported anywhere in the world when only natural stone was being used, argued that so-called unsafe conditions would be hazardous with any type of stone. And he claimed that non-toxic recycled glass slabs would somehow be dangerous, and that despite early data from Australia showing that their ban is already successful, he claimed it was just too soon to know for sure.
Good morning. My name is Marshall Engstrom, and I am the industrial hygienist here at Cambria, USA. First, I would like to acknowledge the absolute bravery of the workers who have testified today and provided their stories. I would also like to comment that the working conditions that they have described in those shops where they worked would not be safe with any type of stone or other alternative product in a fab shop setting. No one should ever be overexposed to respirable crystalline silica, and everyone deserves to be safe at work. Determining whether a specific slab is quarried stone, prohibited quartz, or somehow crystalline silica free under a ban would require complex X-ray diffraction testing. This means an inspector would have to 1, locate and visit the work sites where the slabs are being fabricated, 2, cut portions of those slabs, and 3, send them to an analytical lab for testing. Rather than devote such extensive resources to one among many high silica products that can cause silicosis, we recommend that the additional enforcement resources be applied to workplace safety conditions rather than testing stone slabs. It should also be noted that alternative glass or mineral products cannot simply safely substitute quartz under a ban, as they can still generate harmful dust and exposures if processed unsafely. Unlike Cambria's consumer safety certifications, these products are also untested, which could also put consumers at risk. Further, the situation in Australia was unique and acute in the sense that over 82% of the quartz surfacing was being dry cut. During a Workplace Health Without Borders presentation recently by Dr. Deborah Glass, she shared photographs from worksite inspections in Victoria, Australia, documenting workers covered in silica dust, and conditions were reported to be so severe that regulators bypassed taking actual dust or crystalline silica measurements in order to just immediately intervene in those shops. What needs to be emphasized also is that silicosis develops after years and often decades of exposure to dust, meaning there has not been enough time since that ban was implemented in 2024 to definitively observe its efficacy. While some early indicators may emerge, it is still too soon to draw conclusions about the long-term effectiveness. And moreover, any improvements in workplace safety and health outcomes in Australia could easily be attributed to the implementation of a silica standard there that meets our U.S. permissible exposure limit that was instituted in 2020 and the additional enforcement and education that they have hired in Australia. Thank you, Board, for your time.
Standards Board member Dr. Derek Irwin noted that the nanoscale particles make artificial stone a unique hazard that cannot be addressed by the traditional industrial hygiene methods mandated by Cal OSHA, such as wet methods and MAS.
I think to dovetail off that, when it comes to the science, it's apparent that the issue of nanoscale particle size, which to be clear is 1,000 times smaller than microscale particles, is really what makes this a unique problem, right? And traditional industrial hygiene approaches, I think that are applicable to microscale particles, PM 2.5 that you hear about all the time, are not necessarily well suited for the issue at hand here. So when it comes to the science here, it comes down to addressing this issue using the science that's appropriate for nanoscale contaminants in the air, and the efficacy or lack thereof, potentially, filter cartridges against nanoscale particles produced uniquely by the products that we're discussing here. So on the science, I think, to your point, Chair Aliotto, shedding light on the nanoscale particulates, the appropriate methodology, the appropriate scientific approaches for measuring those contaminants in air, and also the efficacy against PPE and other control measures is what needs to be further illustrated so that that's totally clear with these products as opposed to other products.
Standards Board member Chris Lazick-Davis, while trying to grapple with the situation, compared the situation to asbestos, correctly noting that the failures of the manufacturers to adequately warn of the hazards. However, she mistakenly stated that asbestos was banned and yet it took decades to reduce disease. In fact, asbestos was not banned until 2024, which is why it took decades to reduce disease. If it had been banned in 1978, countless worker lives would have been saved. The failure of Cal OSHA and other regulatory agencies to ban asbestos should not be repeated here with artificial stone slabs.
I think it goes without saying, this is a quandary. It's frustrating. And to see lives slip away is something that none of us want to see. And yet the issue isn't as simple as it appears on first blush. Most of us have lived through the asbestos situation from the time that it was banned, and it was not a complete ban. Understanding that we had products everywhere, installed, inventory, and on. It's taken years to whittle down to what I call the critical few. And we still have asbestos cases today, although the cases are so few by comparison to what we had years ago. I don't know that it's a fair comparison, but in my own mind, I kind of see it the same way. I have to ask myself, where was the manufacturer in terms of hazard communication? Where was the chain supplier? Was there a certification process? There are a whole host of questions and sadly, not a lot of answers, at least at this point in time. Just personally, I'll throw it out there. It'd be easy to say, let's just ban it. But to Dave Smith's comments, banning it won't take care of it today. It'll take several years to actually execute and implement. And I think given the stakeholders that we have involved in this situation, the workers, the employers, the communities, I think we need the benefit of a very robust advisory committee process. The dilemma is that will take about a year. So what do we do in the interim to make sure that this doesn't continue? So if we go advisory committee process, which the proposal to ban would be considered within, there needs to be another set of actions accompanying it that mitigates what we're seeing out there today and tomorrow. That's it.
WOEMA, many other doctors, and the Standards Board's own medical staff have repeatedly given the board an unequivocal science demonstrating that artificial stone is uniquely toxic, not just due to its high crystalline content, but also the nano size of the crystalline silica particles, high surface area on the nano-sized crystalline silica particles, as well as the toxic resins and metals compared to natural stone, which has no toxic resins and metals and no nano-sized crystalline silica particles, and most of which is low in crystalline silica content. Despite this, Chairman Aliotta once again echoed the slab manufacturer lobbyist line of, where is the science?
One issue that I've been asking about for quite a while is, what is the science about engineered stone dust in comparison to high silica content slabs such as quartzite, which is 99% silica? And the reason why that's important is because this is the ban here proposal is only of engineered stone and not of high silica content stone such as quartzite. I don't know whether or not anyone here would be happy with an idea of had we substituted the engineered stone for quartzite and all of the same amounts of engineered stone that have been fabricated over the last 10 years were instead 99% silica quartzite. I can't imagine that anyone would think that to be safe. So this has been a question that I've been asking. What is the scientific evidence for the actual differences and the unique dangers of engineered stone?
Well,
you made a very interesting comment in your comments that there was broad scientific consensus that it is uniquely dangerous based on the particle size, the resins, et cetera. I have spent hours reading this topic. I've probably read 30 to 40 different studies on this very issue, and I have never seen, frankly, a study that concluded that. So my only question for you is, I would love to know what this broad scientific support is, and if you are able to provide some studies for me, I would very much appreciate it, and hopefully you can send them up to the board.
I would love to. I have a bibliography I can send you.
Bringing us back full circle to the devastating human tragedy of this artificial stone silicosis epidemic, Charlie Velasco Ariza from Brayton Purcell LLP shared the toll on workers and their families that he sees every day, helping to represent 423 California fabrication workers with silicosis, including the most recent deaths and suffering among his clients. He urged the board to hear the voices of the workers and the doctors and to act on the science to prevent further harm.
Thank you. Good morning. My name is Charlie Velasco. I'm an attorney with Brayton Purcell, and we represent hundreds of workers with this fatal disease. I have the honor to be representing these guys in this epidemic that we're facing today. And my only reflection comes to real life, to what is living with them and what is listening to the stories they have to tell. All of these guys are very hard workers, and they are committed to do the best that they can for their families. The stories that you heard today are just 5 from people that can still talk. But I have hundreds that are younger than them that are not able to talk anymore. Over this weekend, we lost somebody who was tired of the pain that he had. And he had a cardiac disease, so he was not eligible for a lung transplant. He left his kids, his wife, his life, for something that shouldn't have happened. We had the experience in the world before. This has happened everywhere where the artificial stone products have been sold. And in your hands today is the possibility of changing the future of many families that still have, their beloved people working in these shops. Many people that are thinking in their future, and they don't know that could be caught, just like happened this weekend to one of my clients. Science cannot be ignored when you are deciding on the future of the people that trust you and trust your work. So on behalf of my clients, I appreciate the time that you have today to listen to their stories. But I want you to know there are thousands more, hundreds more, the stories that cannot be told without crying. Thank you so much.
In conclusion, the OSHA Standards Board intends a final vote on the WOEMA petition at the next hearing on May 21st, 2026 in Los Angeles. Please contact your California State Senator and Assembly person. Please urge the board to vote yes to approve WOEMA's petition to prohibit crystalline silica artificial stone slabs before many thousands more fabrication workers are stricken with an entirely preventable artificial stone silicosis caused by uniquely toxic product. Thank you for tuning in to this episode of From Dust to Verdict. I am your host, James Nevin from the law firm of Brayton Purcell LLP. Remember to share, like, and subscribe Stay tuned for our next episode where we will continue our discussions of the silicosis epidemic caused by uniquely toxic crystalline silica artificial stone, as well as the associated regulation and litigation. Para todos los que hablan español, les recomiendo que escuchen la versión en español de este podcast, presento por mi buen amigo Charlie Velasco Ariza.
This podcast contains subjective commentary and opinion-free speech intended to provoke thought and discussion. Investigative commentary intended to shed light on matters of public interest to inform the audience and encourage civic engagement, accountability, and transparency. Findings that are a result of diligent research, fact-checking, and analysis of publicly available material, including news reports, public records, interviews, personal research, experiences, published peer-reviewed medical and scientific literature, published governmental health authority regulations and findings, and other accessible sources. Any conclusions drawn reflect the creator's interpretation of that information and are presented in good faith, and are not intended to malign, defame, or harm the reputation of any individual, group, company, or entity, but rather are intended to be allegations acknowledged to be disputed by artificial stone slab manufacturers and suppliers. The speech herein is protected under the First Amendment of the U.S. Constitution. Litigation privilege, CA-CC 47B. Fair reporting privilege, CA-CC 47D1. Anti-SLAPP, CCP 425.16. And fair use doctrine, Section 107 of the Copyright Act of 1976. This podcast and all content herein are exclusive property of Brayton Purcell, LLP, and are protected under applicable copyright and trademark laws. Unauthorized use, reproduction, distribution, or exploitation of this content in whole or in part without express written permission is strictly prohibited. All rights reserved.